Normal reticulocyte counts, what we do, that's basically not a count, that's a percentage, and the normal value we get is around 0.5 to 2%. It's not a count. And how do you get this percentage? We basically check for each 100 red blood cells, RBCs, on the peripheral blood smear of the patient, how many reticulocytes are there. So it's a value out of 100, and that's why we get it as a percentage. A normal value is, as I mentioned earlier, 0.5 to 2. Usually it is always less than 3% in a normal person. More than 3 is considered abnormal. But there are many other entities are there which I am going to explain. One is called reticulocyte count, reticulocyte percentage, corrected reticulocyte count, reticulocyte production index, reticulocyte index, absolute reticulocyte count. What are these? All these terminologies. We want to know about them. Now, first things first, reticulocytes are nothing but premature baby form of RBCs which come out from the bone marrow as an immature enucleated form of the RBC after spending 2 days, first 2 days of their life in the bone marrow, and the last day of their life they spend in the peripheral blood before they become mature RBC. So usually their lifespan lasts for 3 days, first 2 days in the bone marrow and in the last day in the peripheral blood. This concept is also very important. I would connect them with another thought. Please keep this in mind. Now, normal scenario, not normal scenario, in the normal practice, we basically do reticulocyte count for 3 purposes. The purpose number 1, it is done to distinguish the various causes of anemia, and particularly to differentiate the anemia between hypoproliferative anemia, where the bone marrow is not proliferating, the proliferation activity, the RBC production activity in bone marrow is ineffective or not adequate, like iron deficiency anemia, aplastic anemia, megaloblastic anemia. So this hypoproliferative anemia, they are differentiated from hemolytic anemias. Hemolytic anemia, the problem is not that bone marrow is not producing adequate RBC. The problem is that those RBC, when they get released from the bone marrow, somewhere in the peripheral blood they get destroyed by something like autoantibodies or some infection or some many other causes, microangiopathy, hemolytic anemia, all those things I've already mentioned in my lecture in the hemolytic anemia. So a basic purpose, a very important purpose of performing the reticulocyte count is to distinguish the various causes of anemia, and particularly to differentiate hypoproliferative anemia from hemolytic anemia. And as you understand, hyperproliferative anemia, as the bone marrow, the erythropoietic activity is ineffective or inadequate, obviously the reticulocytes, they would not be producing adequate amount of RBC, so obviously the reticulocyte count would be low. So in cases like aplastic anemia, in cases like iron deficiency anemia, in cases like megaloblastic anemia, in cases like pure red cell aplasia, we expect the reticulocyte count to be very, very low. In case of PRC, it would be even 0% also, pure red cell aplasia. And in the case conditions like hemolytic anemia, where bone marrow is doing its job to produce RBCs effectively, but they are getting destroyed, and to compensate for that, the bone marrow tries to produce more RBC, and that's why the red blood cell count, the reticulocyte count, is usually get high in cases of hemolytic anemia. So a basic purpose of the reticulocyte count, as I mentioned, is to differentiate anemias and to distinguish the causes of various causes of anemia. The second important indication of performing reticulocyte count is to monitor some therapy associated with anemias mostly. Like in iron deficiency anemia, the patient is given iron supplement. In megaloblastic anemia, they are given vitamin B12 or folic acid. In some conditions, we treat by giving patient erythropoietin, and after giving this patient iron supplement or vitamin B12, folate or erythropoietin, we want to check that is bone marrow responding to this therapy or not. And as a follow-up of the therapy, of the treatment, we also do reticulocyte count. And the third important reason which I like to mention as a cause of reticulocyte count is to monitor in cases of post chemotherapy or after bone marrow transplantation that bone marrow has started to come back in its normal functioning state or not. So these cases, these are the 3 important indications. One is to distinguish the causes of anemia, to differentiate between hyperproliferative and hemolytic anemia, to monitor or to follow up of a therapy like vitamin B12, folate, or iron deficiency, or erythropoietin, and third, after a follow-up of bone marrow transplantation or chemotherapy. These are the three key reasons we perform the reticulocyte count. Now, the reticulocyte count is called reticulocyte count because reticulocyte, the word origins from retic or reticulin, which means net-like, and these cells basically have an extensive network which is made with ribosomal RNA, which creates this reticulin net-like network. And another very key concept is this, that reticulocytes can be appreciated on the peripheral blood smear, but the best way to appreciate them is on the peripheral blood smear is to use some supravital stains like brilliant chrysal blue and new methylene blue. But on real life, actually nowadays we use the automated analyzer, and this is the best way, I would say. Actually very accurate estimation could be made actually, and we can use certain fluorescent dye like thiazole orange, which can be helpful to detect it very accurately. Even on normal peripheral blood smear, in the routine stains, we can appreciate them. They have a bluish tinge, no central pallor, and very big cell. But the best way, as I mentioned, on peripheral blood smear would be to use the supravital stains like brilliant chrysal blue, BCB, or new methylene blue, or you can use an automated analyzer, which is, as I mentioned, is thiazole orange. Now, the absolute reticulocyte count basically means that per a certain volume of the blood, how many reticulocytes are exactly there. That is absolute reticulocyte count. Normally what we are performing is reticulocyte percentage, which you wrongly say sometimes as reticulocyte count. Now there is another term which I want to explain, that is known as corrected reticulocyte count. This corrected reticulocyte count, this correction is basically done in the patients of anemia, because we usually get a high reticulocyte count. Why we get this high reticulocyte count, I want to explain in this way. Suppose this is a patient A, which has, I'm observing or evaluating this peripheral blood smear, and he has 10 RBC and 2 reticulocyte count. So his reticulocyte count would be 2 by 10 into 100, means 20%. And compare this with the patient B, who has also 2 reticulocyte, but he has 5 RBC, because his peripheral blood smear, he's anemic, so his reticulocyte count would be 40%. So both of them, they have 2 reticulocyte, but we are getting different result because the patient B is anemic. And to correct this, we usually use a specific formula to get corrected reticulocyte count. And I'll be discussing about this corrected reticulocyte count, another very important concept, that is reticulocyte production index, in my next Insta lecture. So today what I told you, that in this session what I informed you, that reticulocytes are nothing but a premature baby form of RBCs, which gives an idea of effective erythropoietic activity in the bone marrow. Is bone marrow doing its job effectively to produce RBCs or not? And we usually can do it by routine stain, by using some supravital stains like brilliant chrysal blue, or by automated analyzer, which gives even more accurate estimation. And we basically do it for 3 purposes. One, I told you, to distinguish the various causes of anemia, particularly differentiate hyperproliferative anemia from hemolytic anemia. Second, we usually also do as a follow-up of certain therapy like iron supplementation, vitamin B12, folate, or erythropoietin. And third thing we usually do is to monitor after bone marrow transplantation of the chemotherapy. I would continue this on the coming session of the Insta lecture. Thank you very much.